Hello, my name's Laura Lear and welcome to the Thoughtful Leadership Podcast from Ambitious. Hello, so my guest today has a wealth of experience and has worn many different hats, from working with central government through to working with the NHS and Nesta Health Labs. And she is now the founder and CEO of Thiscovery, which is all around innovation in healthcare, but very much rooted in insights and data. So I'm really excited to have a conversation today with Ruth Cousens. Welcome.
Thank you.
So I think before we dig in, because there's so much to talk about in terms of the roles you've played, but also what you're doing at Thiscovery and just really understanding a bit more about your purpose and kind of that mission, I'd love to hear a bit more about kind of where that came from and just start from the beginning, because I know Thiscovery was a spin out from Cambridge.
That's right, yes, it's a spin out from Cambridge University. So we spun out in May 2023, so we've been going just over 2.5 years now. And yeah, where it really came from was that we were part of something called This Institute, which is the Healthcare Improvement Studies Institute. And the director of that, Professor Mary Dixon Woods, she had this idea of building an online platform that would allow patients and staff from the NHS, but also members of the public and all sorts of people to participate in healthcare research. And so I was brought on board in order to I'm not a programmer, so not to write the platform, but to develop the platform, commercialise it, and ultimately spin it out of the university, which we have done. Yeah.
Okay. And so what kind of took you to this particular sort of time and role? Could you talk a bit about, because you've worked in central government and also for the NHS, I'd love to hear a bit about those roles. I'm sure our listeners would.
Yeah, so I was really fortunate straight out of university to join the civil service fast stream, which was a fantastic job. And I quite quickly managed to worm my way into the Prime Minister's strategy unit.
How do you worm yourself into the Prime Minister's strategy unit?
I just kept emailing the same person again and again and again until they got sick of me and said, yes, you can come and work here. And that was really fun because what we did was a lot around the kind of long term of policy. So this was quite a long time ago in sort of happier economic times, and the government really felt that it had more breathing space to be able to look at what will be happening in 5, 10, 15, 20 years' time. And so we were thinking a lot at the time about kind of social innovation, what are going to be the big policy areas that are going to dominate. Obviously, even then, climate change was a big one of those. And so that was a fantastic job. But my sort of, my youthful idealism decided that what I really wanted to do was kind of work more closely on the ground. And I came back to Cambridge, which is my home and where I was born and where I still live, to really work in the voluntary sector. So I did a lot of kind of much smaller charities, much more kind of close to the community, lots of stuff around young people's mental health. Right. And I ended up in a charity called Voiceability, which is an advocacy charity. And the role of advocates is to speak up for people who, for whatever reason, struggle to speak up themselves. And so when it came to working with Thiscovery and thinking about how do we raise those voices, how do we gather that insight from people who are on the front line of healthcare as staff or who are receiving healthcare and benefiting from it, then it just seemed like a really great natural fit. But you mentioned at the beginning that I also worked for Nesta. And Nesta is a social innovation foundation. And so that's the sort of missing piece between the two. And that's the time when I became really interested in not just how do we do policy well, but actually how do we create businesses and create organisations that will deliver social change and social policy. And Thiscovery has become one of those businesses.
And so tell me a bit about the mission and what Thiscovery sets out to do, because I think you identified there was a challenge around kind of the right sort of insight and knowledge to support these new innovations. Is that right? And this was what Thiscovery has set out to try and bridge?
Yeah, absolutely. So, I mean, it seems very obvious to everybody that if you're setting out to produce a consumer product, that you would go out and ask consumers about whether they like your product or not. So you might have a prototype that you try on people. You might even consult with people before that. But for various reasons, over the decades, that hasn't happened in health. So we have tended not to ask people who receive whatever intervention it might be. It might be a service, it might be a mental health service, it might be a pharmaceutical, it might be a device, it might be all sorts of different things, how that would best fit into their lives in order to make sure that it achieves its outcome, right?
Yeah.
So there's some quite eye-popping statistics about how many drugs that are prescribed are wasted because people forget how to take them correctly, or they fail to take a full course of antibiotics or things like that. And that's because people live, particularly people who are managing long-term illnesses, live quite sort of full kind of very demanding lives, I think it's fair to say. And so really the purpose of Thiscovery is to make it easy for lots of different organisations to access the insight they need to design products and services that meet people's needs. And of course, the other side of that equation is staff. So if you're designing a medical device, you want to know that staff is going to fit into staff workflows. It's going to be operable by them. It's going to make their lives easier, not harder, those kinds of things. And so that's the kind of insight that we try and gather for our clients.
Amazing. And do you, obviously, it's sort of a private sector innovator in yourself, are you looking to then use those services within the NHS as well? Is that kind of
so we kind of have 4 different groups of clients that we work with, and one is quite often quite early stage innovators, so people with maybe a prototype, maybe a product idea. They're very early on in their business journey, and we help them really to understand the needs of the end users that they want to serve. We also work, as you say, in the system with NHS organisations, and then it's much more usually about a service. It's about designing a service so that people get the most out of that service and it delivers, what we need it to deliver from an economic perspective as well. We also work with third sector organisations, so we've worked with some very big charities over the last year. Often we're helping them around perhaps a campaign or a strategy or some sort of piece of policy work that they want to do. And then the 4th group is very much our home where we came from, which is academic projects and supporting academic projects.
Okay, great. And how long did you say you've been running for?
2.5 years, but in total, so I joined the university initially 6 years ago.
And so how do you manage that transition from university to sort of spin out through to a commercial business?
Yeah, it's a really interesting area, and there are whole sort of organisations within universities. At Cambridge, our one is called Cambridge Enterprise, who are set up to help academics commercialise their research. And so in some cases that's a new drug, in some cases it's something for a jet engine, or and in our case it was this platform, this online platform, but also the kind of know-how that goes around that and the research experience that goes around that. And I mean, it's really interesting. Obviously, universities are a very particular sort of organisation, and people are very used to working for, the University of Cambridge is huge, as you can imagine. Yeah. So a very big organisation that has a level of bureaucracy, as you can imagine, but also has things like very secure pensions and those kinds of things. And when you move into the startup world, there's trade-offs. So you can make decisions much more quickly. You can hire people much more easily. You can shift and pivot in the way that startups need to do. But on the flip side of things, we're always as good as our next 6 months or the 6 months after that, and that commercial imperative, which doesn't exist in quite the same way in universities. So it's been interesting to see the way that people kind of thrive in the different environments as well. And
it's quite a shift, isn't it, from academia into that sort of,
absolutely.
commercial world.
But a lot of academics, I think, really appreciate that, because it's a way of getting what otherwise would be I guess, very maybe slightly esoteric kind of research, actually practically doing something in the real world. And ultimately, that's what we all want to do. We want to make a difference. So
absolutely. And that's
it's
really...
a route to that,
So sounds like, you've got a real sort of mission and purpose. And can you talk a bit about, because I think there's a lot of people interested in that kind of a bit more of your own personal process of going through that and making that decision to go from that academic kind of, as you say, safe house to kind of, taking that, calculated risk as well to being that sort of entrepreneur?
Yeah, I mean, I'm probably unusual in the sense that I wasn't already in the university. And when I joined the university, it was explicitly to do this job and commercialise this and lead the spin out. So, as I said, my background was kind of in social innovation. I've also done, for example, an exec MBA. So I was thinking about business more generally and how businesses work. But I think if I reflect a bit, and I wouldn't want to speak on their behalf, but some of my other colleagues who've joined us from the university, I think it's an opportunity I think it was very clear that we were always going to be a very values-based organisation, and so they felt that there was a kind of fellow feeling with the university in that. But also to give them an extra string to their bow and say, well, I've done this, but in a commercially based organisation with a kind of commercial imperative, which we have. We need to pay the bills every month. But I've been able to kind of take my research background and my values into that space.
Yep. And what have been the most challenging moments running a business? Have there been many?
Yeah, of course there are almost daily, aren't they? And there are the kind of very small things like you get an email from a client and they don't seem to be entirely happy with what you've done, and can you unpick that and make sure you work out what's gone wrong and put it right again, and those kinds of things. And then some days you're working out what the next stage of funding is going to be like, and that's a whole different level of problem. But I think for me it appeals to me because I enjoy problem solving, and so kind of unpicking those things day by day, I think is bizarrely fun.
Yeah, no, absolutely.
So, yeah.
Keeps you busy, doesn't it? And in terms of wider NHS innovation, because obviously it's always a big topic, isn't it? And obviously challenged with resources and time, but innovation being key. There's lots of clinicians who are moving out of the NHS to start up organisations. We've had a couple on the podcast actually talking about that innovation and needing to actually go outside. I mean, can you talk to some of those challenges around innovation within the NHS, and also the kind of, obviously what you're trying to do is to help that innovation, but through that deep research and insight?
Yeah, so I think that, first of all, I do think that the NHS is getting better, and clearly it's a very big plank of the 10-year plan, which is the new sort of policy framework for everything to do with health in the NHS for the next 10 years, obviously. And I think a lot of thinking is going on internally in the NHS around how do we support innovation, how do we support clinicians who want to innovate within the NHS, and all of those kinds of things. I think that probably one of the key problems that people would identify is around adoption and spread. So it's not proving the case for your thing in your local area, and obviously clinicians work locally, so their local hospital or their local community trust or whatever it might be. It's actually then how do we make sure that our innovation is being used across the whole NHS. And I think that, there's this concept that people talk about called pilotitis, where you do a pilot and you do another pilot and you do another pilot and you do another pilot. Yeah, exactly. Yeah. But I do, and I do think that is problematic. But then you have the really interesting cases of, some technologies are just so useful that they get picked up by individual clinicians and just adopted. So one example of that would be ambient voice technology, which is AI that listens to you and writes down the notes for the consultation. Yeah, exactly. And it may well be that his trust has sort of supported that, but it also may well be that he just picked it up and ran with it. So I think that there's an appetite amongst clinicians to innovate themselves, but also to use those innovations. And I think the climate is gradually coming round to making that more possible within the NHS.
It's such a huge machine, isn't it? As you say, it's kind of how you move that on. So what's the alternative then? So if the clinicians are working locally, and obviously pilots are often done locally, what else could be done, or what's the different approach to that?
Well, I can only speak from work that we've done previously, but there was some work that we did with our former colleagues back at the University of Cambridge when we were part of the university, and subsequently since we've spun out as well, which has been a big programme around transforming the way that labour is monitored, so when somebody's having a baby and how that is monitored. And the sort of the theory that we've tried to apply, and that the programme has tried to apply, is there a level of this that we can design at large scale, which is where our platform comes in, because we can engage people at large scale across the whole geography of the NHS. So is there a way that we can design this with everybody across the country in its fundamentals so that people can then localise it?
Sure, okay.
So they can say, well, I'll take these kind of core elements, but my population locally is, let's say, very rural, and so I need to tweak it in this way, or my population is older, is made up of older people, so I need to tweak it in that way.
Okay.
So I think that's obviously one approach that we've or found to be really interesting and useful. And I think obviously doing it online and at scale is the way that you can achieve that.
Yeah, okay, I get that. So instead of going into the kind of real deep-rooted issues of that particular region or locality, it's about, okay, what are those core themes across, and then you can go into the kind of more detail.
Yes, exactly.
And in terms of kind of, are you able to talk about any of your clients that you've worked on, just to kind of provide a bit more of the detail around exactly how you work as an organisation and the sorts of research you go into and how you do that?
Yeah, I can probably, obviously a lot of the commercial clients we work with, the work that we do with them is kind of confidential, but there have been a couple of case studies that we've sort of talked about publicly, and the organisations we've talked about have done as well. So we worked with a very small startup, again a clinician-led startup that is looking at ways of supporting young people with mental health issues, and particularly young people who are waiting for formal services. So we all know that there's this really desperate situation of long waits to get a referral to a child and adolescent mental health service. And so we worked with them over a year ago now, and really what we were trying to help them to do is understand the needs of people in that phase. So the work that we did was actually with parents and with educators and with clinicians, asking them to really sort of highlight what their core problems were, and also what they felt worked in their situation. So some of what's in the report, which is publicly available, is obviously quite sad and quite difficult reading. Absolutely. But there are some really positive areas as well. So where people have had access to talking therapies at school, for example, and those kinds of things. And I think for this company, which is called Orly, ORLI, what they've said is that working with us was really helpful on a number of fronts. So they were able to really embed their design of their new product and their new services in the needs of all of those people. Yep. But also that they were then able to sort of use that data to demonstrate to perhaps, well, in one case, an accelerator program that they were then successful in joining. But also very much that it kind of also speaks to the people in the health service who might commission them, so that they can say, we know that this is what's needed because we've asked and we've gone out there and we've been told by people that this is what's needed. And that's really kind of fundamental to our approach. There's been this argument made for a long time now, at least 2 decades, that it's the kind of ethically and morally right thing to do to ask people, and it is, don't get me wrong, it absolutely is. But what we're trying to do is make that more commercially grounded as well, and say that actually understanding your end user can save you a lot of time and wasted effort and energy in designing something that's wrong and doesn't fit and isn't even, sometimes it's the case of the need that you're addressing is just not, it's number 10 on the list of everybody's needs, not number 1 on the list of everybody's needs. And in a resource strapped situation, it's not going to sort of solve the problem that everybody's most worried about.
No, it's fascinating, and obviously NHS is huge. As we talked about the different trusts and working locally, but have you been able to make any inroads sort of more centrally in terms of being a voice and a leader to kind of really push this forward?
So I think we don't necessarily see that as our role. I think that we see our role is as enabling and empowering our clients. Yeah. So, for example, one of the third sector organisations we've worked with in the last year or so is Alzheimer's Research UK, and we did some very carefully planned and designed work with people with a dementia diagnosis or people experiencing symptoms that they felt were dementia and they were on that pathway to becoming diagnosed. And then Alzheimer's Research UK have had a big a campaign this year around the diagnosis pathway and the need for people to get diagnosed, because there are but there are drugs coming down the line to slow the progress of dementia, particularly. But of course, if you don't have a diagnosis, you won't get access to those drugs. And so so we were able to kind of, so they're the ones, and rightly so, because they're the policy experts, they're the subject matter experts raising that voice centrally. But the work that we can do can support that.
Okay, great. And so just going back a little bit in terms of the sort of journey you've been on with the business, You've presumably gone through rounds of investment as well. Can you talk a bit about how have you approached that and what's that process been like?
So we've only had one round of investment, and because we are a kind of very values-based organisation, we were really fortunate to find a partner in the Health Foundation who are have invested in us on a kind of social investment basis, which is not to say that there's no commercial imperative, but just that they're concerned about creating impact as much as they are concerned about creating a financial return. So I think our experience is probably not...
Finding someone who's aligned is really nice, isn't it?
Yeah, exactly. And we were really, really fortunate to be able to do that. Having said that, it still took a long time and there's a huge amount of legal stuff to go through and all of those kinds of things. And I think the first time you do that as a kind of new business founder, it's quite eye-opening.
Absolutely.
And you know, we still feel a great deal of responsibility to them in exactly the same way we would to any investor. But yes, I think we were probably fortunate in that respect.
And what's it been like? What have been, you know, being a leader, running a business, being responsible for a team of people, building a culture? Oh,
that's a huge privilege. I think it's a huge privilege. I mean, somebody asked me the other day, not that I have these kind of conversations like every day of the week, but somebody said, would you be able to define your personal values? And it suddenly dawned on me that because I've been able to lead the business and start the business from scratch, I've been able to build a business around my personal values. And that's extraordinary. Like, you don't get that opportunity in a lot of jobs. And so, you know, I hope that the culture that we've created is both, I mean, one of our values is pragmatism, right? So it's like, let's get something done. Let's make sure that we are moving the dial and doing stuff that is actually having an impact on the ground. But at the same time, another of our values is empathy. Like, let's be kind people. Let's be a kind organisation. And so, you know, I hope that my team, if you ask them, would say that we're a really good mix of both of those things. Like, we want to get stuff done. We're not here to, look pretty. we want to deliver, but we want to deliver in a way that we're proud of and that we feel reflects the values, not only of ourselves, but, you know, with being one of our sort of predominant spaces that we work in is the NHS, you know, that it's a very values-based organisation as well.
Yeah, absolutely. And it's been interesting because we've had so many really great conversations here around that kind of culture piece and values and the whole kind of, we were talking about that when we spoke last week, the whole kind of concept of this podcast was around thoughtful leadership and actually leadership. Obviously, a lot of businesses need to make money and need to grow and need to be commercially viable, but actually you can do that with the balance of people and planet. And actually those two elements, if you get them right, will help you grow.
Yeah, absolutely. And I think it gives you, because there's no avoiding taking tough decisions as the leader of a small business, as the leader of a new business, as the leader of a growing business. There are tough decisions along the way. And I personally have had to take tough decisions along the way. But if you are grounded in a framework of values, then you can actually make those tough decisions based on those values. And actually it gives you a really strong rationale and framework for making those decisions. And I think that actually makes it easier on everybody because there's an internal consistency. You're not being sort of hypocritical through that process. Tough decisions have to be made to protect certain things, you know. So, I think it's actually really helpful from that
authenticity, isn't it?
And I don't think there's maybe we've gone through in the last sort of 20 or 30 years, this sort of era of the kind of hero CEO who's out there working 60, 90, 100 hours a week, you know, but, you know, blasting through everybody and let's move fast and break things. And I prefer the phrase that's become a bit more kind of common recently, let's move fast and mend things, you know. So I think hopefully we're all moving out of that sort of slightly what's become very hackneyed and cliched kind of phase. And I think it was really interesting. I was at an event in Cambridge recently and was immediately kind of bumped into 3 or 4 other women of my age leading businesses. And I think, you know, that's what we need more of. You know, we need people with experience, with, you know, kind of, I think often people a little bit older bring with them a great sort of wealth of having been there, done that, essentially. And I think it's really encouraging to see more and more people in that space. And I read an article the other day that said startup founders are much more likely to be successful if they're over 45. So
interesting.
Yeah.
Oh, like that one.
I'll see if I can dig out the stat.
Dig it out, absolutely.
Yeah.
So what's next in terms of where do you, as a leader, kind of where do you want to get to? Have you got a kind of 5-10 year plan in terms of what you want to achieve, and not just from a commercial perspective, but in terms of what you want to really do in this space to move it forward?
So I think that for me, my kind of total preoccupation at the moment is AI and large language models, and how can we leverage those? And I think there's a super interesting space around, rather than using large language models to generate answers and content, and to, there's lots of businesses around who will tell you, well, I'm going to use this, that or the other thing to scrape the internet and decide what people think about something. There's actually a huge space to use those models to ask people and to consult with people and to handle. And one of the reasons why large scale qualitative research work is so hard is because you end up with tons of content to sift through. But of course, that's not a problem in the same way that it was. And so for me, all of my focus at the moment is how do we best leverage that? But again, in a kind of values-based way, right? And in a way that is sensitive to things like, obviously data issues, and to transparency for people as well. So, you can imagine a model where rather than a human interviewer, you had a kind of AI interviewer. But obviously you would need to be utterly transparent about that. But for some people that's going to be preferable, right? Because we have some subjects which touch on some very either personal or difficult or issues, and you don't necessarily want to talk to somebody. It might actually be more encouraging to know that you're typing into a into a sort of anonymous space. So, there's all sorts of interesting, I think that's a very interesting space that's there at the moment. And
I've spoken to a few people about that, because we're doing a lot of work in AI, and as you'd expect, everyone is. Lots of workshops, how we use those, the LLMs really well, researching around clients in particular sectors and industries, and spoken to a few people about that kind of concept of, yes, focus groups, for example, have been and still remain something that obviously is a useful kind of tool, but actually you can do that in the right way through often AI as well, particularly around sensitive topics. How are you approaching that? Yeah,
absolutely. And so I suppose we've, even prior to the last sort of 18 months, 2 years of sort of explosion in AI, the very fact of working online, I think there's an understandable and also very natural attraction to and kind of affection for face-to-face work. So doing focus groups, doing interviews, doing all those. And I don't think that, we're all humans, right? I don't think that will ever go away, and it need not go away. And you can get a huge amount of rich, important data from that. But what working online gives you, and what working with AI will increasingly give us, is just exactly that, a lot more scale, a lot more ability to understand, and also diversity. And that's really, really important, because it is possible to fall into the trap of asking the same group of people the same things all the time. And particularly if you're asking people to, let's say, participate in a focus group on a Wednesday afternoon, right? There's only a certain group of people who are going to be able to do that. And they might not be people who are sort of economically disadvantaged, or who are carers, or who are from, non-English as a first language speaking communities. And so it does actually open up a huge amount of opportunity. That doesn't mean to say that we should disregard risks like digital exclusion, and those kinds of things are really important to consider. But a bit like I was talking about earlier with the Alzheimer's Research UK project, we found it possible co-designing with people with Alzheimer's to deliver online in a way that I think that 5 years ago, when we started this, people would say, well, people with Alzheimer's are not going to be able to participate on it. I mean, there was even the kind of, very lazy stereotype of old people aren't online, which just doesn't hold anymore. Absolutely. It's just not true anymore. So,
So that's the kind of AI. So you're using AI anyway now for your research. And you're also a combination of different sorts of researchers, of tools to do your research at the moment. So focus groups, online surveys as well.
So we do everything online. So we don't do any sort of face-to-face work. But we use lots of different sort of interesting social science, but slightly nerdy social science methodologies online. Yeah.
Okay. And so what do you hope for then, if you're going to look into a glass ball and look at, in 10 years' time, obviously we've got the NHS 10-year plan, at the end of that 10 years, what do you hope to see more of?
Oh, I think healthcare will be unrecognisable, actually. And I'm a perennial optimist, so I think in a good way. I think in a good way, I think there'll be a lot more access. I mean, people are even, able to book GP's appointments online, which they weren't able to, really, really basic stuff like that. But I think that, so I think that healthcare will have changed completely. What I hope for is that, and I say this relatively often, is that I hope that if you are an innovator in the health space, or in any kind of social policy space, actually, also education and things like that, environment, that you have a tool, and I hope it's our tool, that you can reach to engage with your end users in exactly the same way that if you were a brewer producing a new beer, you would do, you would send samples out. I just wanted to be completely natural. For the very first thought of somebody with an innovative idea to be, right, I'm going to run that through Thiscovery and see if my assumptions that I'm making about this need are really valid, or I've got this great prototype, but I realise I need to tweak it for people with, let's say, mobility issues, for example. And that will be super, super easy because we have an easy mechanism of contacting those people.
So could Thiscovery become a platform then across the whole of the NHS that is just...
The whole of the world.
Is that the aim? Because it's kind of, at the moment, they come to you for the service, presumably, and they buy into it, or you offer them a consultancy and then the service itself. But in the future, if everyone had access to it across the NHS, it's just on their systems, they could go into it and just, put in what they're looking for and do the research. Is that kind of what could happen? Yes.
I think with the caveats that, as we always say with AI, that there still needs to be a human in the loop and all of those kinds of things. But yes, that's what I would hope that what we're able to do is offer that. And so if you want to say, my product is for, men over 75 with XYZ condition, that you can easily consult with them in an hour and you'll get you'll have that information.
So it's getting real information from those users and anyone else who's going to be an influencer within that piece. No, it's fascinating. Well, I really hope it does. It'd be great. And I'm wishing you all the luck, because I think it's such an interesting space. And there's so much innovation, isn't there, and out there. It's just, as you say, how do you get that to actually happen and to work? And as you say, so it doesn't sort of doesn't cost so much time and resource and then not work in the end. So
I think that, unfortunately, sadly, healthcare has been a kind of graveyard of great ideas, and not just in the UK, but across the world, because of failure to get that traction, failure to get that adoption. But I do think we are in a moment now where that is changing. And as I say, I'm perennially an optimist.
Well, before we end, I was going to ask you about the international piece, whether you feel you can speak to that at all. But I was interested, do you think do we struggle more here in the UK within the NHS? Because often a lot of people look to the US. I know they're very different systems, or Australia being a smaller sort of, market anyway. Is it harder here, do you think?
It's definitely not my area of expertise. But I think that, you only have to talk to, a very few investors to discover that what they want to fund is essentially a market outside of the UK. So I think that, again, that's another thing that is going to have to be tackled over the next 10 years in order to get that traction. But because we work predominantly here, then that's more my
there's always that wider business conversation, isn't there, around line, if you want to kick off and start a business, you go to the US, because it's full of that kind of innovative
that
kind
perception.
Of push. But hopefully that's shifting, because there's definitely the need and the want, isn't there, in the UK to kind of make these things work.
And also, I was talking to somebody the other day who was saying, Europe is increasingly becoming a much more attractive place to start
Yeah.
And they're only just over
just
there.
It's just the languages, isn't it? I think there's always the barrier, but no, absolutely. Well, thank you so much for sharing your story and your passion, and obviously what you're doing at Thiscovery. It's really interesting. So it's been great to talk to you.
Having me. Yeah, lovely to talk to you. Thanks.
Thank you.